The calf. The calf is pretty easy to tape, actually. Not too involved in this. So just to refresh your memory about anatomy, or to teach you a few things if you're not very familiar with the calf, the more superficial of the gastrocnemius complex is the gastroc, and you do have two muscle bellies. So you can see there's an inside muscle belly and an outside muscle belly. Taping the calf in the way that we're going to be showing you targets these gastroc muscle bellies, and you can target either the inside or the outside, or you can do an inside and outside taping and target both of them. It just depends on what you want. This type of taping is great for runners, it's great for toe walkers, and yes, you can use K-tape on pediatric patients or on kids. It's not a contraindicated modality for them. You can use this particular calf taping on any sort of tight calf muscle. Sometimes in clinic, I see this on people who maybe had a sudden increase in walking activity, or perhaps ran a 5K or a 10K that they hadn't necessarily trained for. The other times that you may see this are people who are weightlifting, and as you start to compensate, they may use their toes more. Or people, honestly, who jump a lot. You can strain your calf a lot because jumping really is dependent on those calves and that toe off when you propel yourself upwards. So lots of things that this can be used for. I don't know if I mentioned this or not, but I also like to use it for an Achilles strain too. It's a great general taping for that entire region. Now, if I have a genuine Achilles only strain and not too much tension in the muscle belly, there's a little bit different taping that I'll use, but this is a good overall taping for this region. So now let's watch me tape my patient. I have a pretty long piece of tape that I've cut from a continuous roll. You could use a pre-cut, but it might not be the size you need. I'm applying my anchor at the bottom because this is an overused calf, so we want to help calm it down and inhibit it. Now, pay attention. What I'm going to do, and you have to look very closely, is I'm going to press his foot against my leg to send it into dorsiflexion and hold it there so the muscle is stretched out as I bring the tape up and apply the rest of it. Let's watch it again. So, I'm about to apply my anchor, no tension, giving it friction, helping it stick. Keep a keen eye for that moment when I press his foot into my leg to help stretch that muscle out while I apply the rest of the tape. Here it comes. I'm going to lean into that foot, boom, locking it down. Now I'm going to apply my tape, pulling it up, giving it tension, and then no tension at the top. Something to also note is the gastroc does cross the ankle and the knee joint.